Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on vhha.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Podcast episodes also air Sundays at 10 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, and 16:50 a.m. in Hampton Roads. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Today, we're pleased to welcome Tom Farley, a dedicated advocate for mental health and addiction treatment who is a featured keynote speaker at the upcoming 2025 Virginia Behavioral Health Summit, scheduled for September 25th in Richmond. Our conversation will delve into Tom's story, work, and preview his role at the Behavioral Health Summit. So welcome to the show, Tom. Thanks for being with us.
So glad to be here. Yeah, can't wait to get to Virginia. That'll be fun.
Well, we're so excited to have you. So return listeners know we like to start these conversations by getting to know our guest a bit better. What we know is that you graduated from Georgetown and began your career in banking and finance before running the Chris Farley Foundation, a nationally recognized nonprofit focused on substance abuse prevention that is named in honor of your late brother. You also co-authored The Chris Farley Show, a New York Times bestseller about your brother, comedian Chris Farley. As someone in recovery yourself, this is work that is passionate and personal to you. Today, you work with Recovery.com, an organization that helps connect people with needed resources. Because all of us are more than just the highlights on our CV, Tom, what else should people know about your unique personal story?
Well, it's been a long journey. Thank you. Yeah, I kind of had this playbook that I thought I'd kind of follow. I'd have a corporate career. I was the oldest of four brothers. We have an older sister. But I just felt like, and I wanted it. I loved that. I went to Georgetown, worked in New York. But then this event happened in my life, and Chris, it wasn't just a drug overdose. It was a very public one. So there's no running away from it. And I knew that I wanted to help others, and it's also something I knew Chris would want me to do too. But I also knew that, and I don't know how I kind of came to this conclusion, but I also knew that if I was going to deal with this pain and this grief, I needed to talk about it. So I started to go into schools, and I took a kind of page from not in Chris's book, but my brothers Kevin and John, who learned their comedy. They're all professional comedians at Second City in Chicago, learning this thing called improv, and it wasn't just stand-up comedy, it was improv. It was done in a group, a connection. And I just thought, wow, that's such a great tool just for people to not be isolated like I felt. And so I started to do that with the Chris Farley Foundation, helping a lot of people. But, it took me a long, long time to realize I was just telling somebody else's story. As good as that felt, I was still experiencing all sorts of ups and downs and train wrecks, as I like to call them. And I couldn't figure out. I would have chunks of time where I would be sober. I would say, well, I guess, I shouldn't drink either. So I would try to be sober. And it inevitably, life's stress, stresses of life would come and hit me, or a really great time that I thought it could be enhanced or deadened by the old standby drinking. And finally, I kind of, after all this talk and being in this space and advocacy work that I did in addiction and treatment and recovery, I'm like, maybe I should take a little harder look at it. And I started my own journey in recovery. And I got to tell you, for somebody that always wanted connection and struggled with it, recovery gave that to me. Something I always wanted. There it was. And so it made sense when it finally, when it was my turn. And now I'm telling my story, and I'm getting more and more people interested in that. And the journey's not over, which is even more fun.
And what you said ties into my next question, and it's about your brother. So it seems like when a person is famous, the world has a relationship with them and a perception about them that is different than family or friends who know that person more intimately. You shared some of that in the best-selling book you wrote about your brother, The Chris Farley Show, and championed his life and legacy through the Chris Farley Foundation, which offers humor-based programs to help young people build communication skills and create supportive environments. Because your brother had a larger-than-life persona, I imagine it's possible for people to overlook the thing that those closest to him see as his enduring legacy and message to the world. As someone who has carried that torch, so to speak, what is it you want people to understand in that regard?
Well, it's interesting because I knew the world wasn't seeing the Chris I knew. And for Chris, I know he wanted to connect with people and wanted to make people laugh, but he also wanted people to understand who he was. And I think not getting that was hard for him. And all these years later, when I was kind of really reflecting on my journey, it hit me that the way I described how my life was going could easily be described. Chris could say the same thing. And that is, we could be in the middle of a room or a bar, surrounded by people, center of attention, making everyone laugh, and yet not feel more like we were standing on the surface of the moon. And like, outwardly people are like, oh, this guy has everyone, just riveted and laughing. But inside we're like, we're feeling so isolated and so alone. That's when I started to realize that's how I was going through life, is when I really understood kind of the pain Chris was going through as a celebrity that really just wanted to connect. So
thank you so much for sharing that. Yeah. And so throughout this journey, you've been open about your own recovery and have worked to change how people talk about addiction. Among the barriers to treatment and recovery are the stigma associated with it, as well as getting access to treatment services, which are increasingly in high demand across the nation. It feels like substance use awareness has grown and destigmatization is happening to some degree. In your view, what more needs to be done and how do we continue that progress?
Well, I think it would help not just people. First of all, not everyone in recovery, has gone to treatment. People come to recovery from all sorts of journeys and places, and they continue their recovery in different ways. And so I think we really need to understand kind of that it's not, yes, at some point there's an addiction, there's a physiological kind of thing that has to be treated, but the mental health side just cannot be underlooked. And again, a lot of people, I think most people are feeling some sort of struggles mentally. I mean, like everyone globally went through the same pandemic. So start there. Everyone knows what isolation feels like, and we didn't like it. And so it's really trying to get to that place of authentic person. I spent a lifetime trying to kind of build this person that I wanted to give out, show the world, but it wasn't me. And I think we need to get back to that whole thing of like that sense of belonging. Like people need to be accepted in with all of their otherness and all of everything. That's what makes that connection even more interesting and fun. But as long as we're not that real person, you'll never have the connection that you wanted. When it finally dawned on me, when I started working on some of these principles that I learned in recovery, like rigorous honesty and gratitude and humility, it dawned on me like the person I was putting out to the world, who I created because I thought that's what the world wanted of me, that who I needed to be. There's no way that person could be grateful or humble or rigorously honest because it wasn't a real person. Only I can do that. And once I started to, and that's scary and it takes vulnerability. And I tell people, the more you lean into that, the fear and the self-doubt and the pain diminishes. And all of a sudden, this world that you want to show, this authentic person to welcomes you. And you couldn't have convinced me of that. I had to lean in and be a little vulnerable, be a little painful, but all of a sudden, wow, the rewards were everything I wanted.
So, here in Virginia, private hospitals handle more than 90% of total behavioral health admissions for voluntary and involuntary commitments. Hospitals are also working with partners and stakeholders to add bed space, develop crisis intervention services, create intensive outpatient programs, empath units, ED diversion programs that get people to the right setting for care, and more. These things take resources and often require public and private sector collaboration. As you look at the treatment landscape, are there innovative programs or approaches you view as particularly effective?
What I am really encouraged by in this space, if you will, the two biggest areas of growth that we're seeing are in peer support and in sober living. And why I love those is because when you went away to treatment or for any illness, you went away and your family, your community, people didn't have to worry about you. You're out of sight, out of mind. And sometimes that's necessary, but still you're out of sight, out of mind, but you're left with stigmas and opinions and misinformation. But these two things, these growth areas, bring that healing back into the communities, and communities, families get to see what a healed human looks like. These people that have written themselves off, their communities written them off, their families may have even written them off, and now here they are doing these amazing things in the communities. People need to see that, and so I think that holistic approach, it's not just treatment, it's all of these things, which take a lifetime. My recovery journey is never over. I'm learning so much more. I the things that I said early in recovery, that I didn't know. I didn't have the tools I do now, but I see my progress. So I think we need to find the treatment providers and the behavioral health institutions. They need to find connection too. Take a hint from recovery community. Like, we need connection constantly. It's not just 30 days and you're all better. We know but yet there's still that belief.
So we've talked about your work as an author, speaker, and your experience leading a foundation. Today you work with an organization called Recovery.com. If you would, tell us more about them, what they do, and your role there.
Well, it's funny. When I met them, and they're a startup here in my hometown of Madison, Wisconsin, which I've, always loved. We just kind of have this different DNA. So I love that this was created here, but it started as a website. The founders saw all these barriers to treatment or directories out there that misdirected people. And they said, we can do this better. And they did. And they matched with a patient first. Like, what do you need? And so they did that. And then they bought the domain name recovery.com, and it hit them like, oh my gosh, now we gotta be that. We gotta honor recovery. And that's when I said, yeah, I have to work here, because treatment is just so big, but recovery, it's the rest of life. And so starting from there, still trying to find the best treatment. But what I love is how we built up this other resource, finding peer recovery, finding sober living, but also understanding of kind of what these questions that everyone has, what is this treatment? What does my insurance pay for? It's really giving agency and control back to that person. Treatment is always something you're pushed into. A doctor tells you need it. Your family says you need it. You may have had an intervention. And yeah, we talk about some level of acceptance and surrender, but you're really not, you're still not taking control. And I think our website not only matches up the right place for you, but gets you a little bit more control of your life with some of these questions. It's that whole kind of, and again, starting with patient first. And I love the fact, because of just the work I've done over the years, people have always called me and asked me, I've got a nephew that needs help. Where do I go? And I used to always give them a name. Well, try this person. They've got a good reputation. And I think doctors do that too. Who's in network? All this kind of stuff. But it dawned on me but I don't know your nephew. I don't know what needs. I don't know what other things are going on. Now I get to just say, go to our website. But then I come back, I'm like, but now let me help you the way I can. You mentioned that you're doing an intervention. Does your family know what that's going to look like? And let me help you with kind of the family, like as a family of somebody with an addiction, like a family member, like I can talk about those things, the things that I know about. I don't know about, I know treatment because I've networked with people, but I don't think that's the best way, So, I love that it's what do you need? What's the best treatment for you? But also educate yourself and build back some of that agency and control and get your life back. Yeah. One last thing about this place. What blew me away more than anything was this culture. So I've been in Wall Street, some pretty dysfunctional cultures. And I came here and not everyone at recover.com is in recovery. It's a tech company, really. There's a small percentage. But like we start meetings, I went to the first meeting and instead of tell us about your role or what are your plans or strategies, every meeting starts like, let's go around the room. What are you grateful for? And I'm like, wait a minute. Companies can do that? And it builds this thing that I've always loved about recovery, this connection and caring about the other people around you. They're doing this on the business level. So I just think that what a great model that is, not just finding treatment or finding recovery, but just walking the walk,
So in a few weeks, you are slated to be a keynote speaker at the 2025 Virginia Behavioral Health Summit, which is hosted by the Virginia Hospital and Healthcare Association and the VHHA Foundation. The summit's theme is community, building an accessible system of care across the continuum. It is being held as an in-person event on September 25th. People who are interested in seeing the program lineup and registering can visit our website, vhha.com, to learn more. There is a link on our homepage to the event registration portal. With that background, Tom, can you share a brief preview of what your message will be to that audience?
Absolutely. Again, I use my journey and my story to highlight all these things that we work on in recovery, and it's all really grounded in connection, and community. So I love this theme, and I think we can't talk enough about it. So I use, as I said, how I've come out of isolation and built my community through stories and my experience as not just a family member of somebody with an addiction, and somebody that died from this disease, but also somebody in recovery myself and what I had to learn along the way. But I love more than anything that I get to do it. Not that I had a choice, but my last name's Farley. I mean, I have to do it with humor because life is joyous. And whether you're, struggling or going through whatever it is, that shouldn't be a barrier. Like, oh, if I do this, I'm going to not have any fun anymore. One of the first things I learned in recovery is like, man, you're not going to tell Farley he's not going to have fun anymore. Like, that's not that won't work for me. And I redefined my definition of what fun really is. And I think I'm doing that. And I want to spread that message too, that this is life. It's joyous. And the work that we're doing, whether it's in treatment or recovery, any sort of the behavioral health continuum, that's what we're trying to deliver. And I hope that we deliver that message more than anything that we can. That's what we're doing.
Yeah, thank you. I love that. And thank you so much for being so candid and sharing your personal journey. I'd like to ask if you could leave our listeners with a message about recovery, what would it be?
A message about recovery. One of my favorite sayings that I say all the time is that we tell our stories because we don't heal in isolation. And every time I get asked to speak to a hospital group or a community group or even an AA meeting, I make one thing very clear, and that's what I'm doing, what you're hearing. It's not me telling my story or here's my journey. What you're really hearing is me healing. And every time I tell my story to a group of people, that's what I'm doing. I'm healing. And I hope I model that because I think we have to do that. We have to kind of lean through it's scary and it's painful, but that vulnerability delivers the connection and the pathway out of isolation that we're all looking for. That's my thing. It's like when I talk about recovery, I'm talking about me healing. I'm talking about connection, all those things.
Thank you so much. And thank you for being with us today. Before we let you go, we do have a tradition to close things out by asking guests a pair of surprise questions. To keep things interesting, we've got a list of 10 mystery questions. So please choose 2 numbers from 1 and 10, and I'll ask you the corresponding questions.
Okay. All right, let's go 3. 3 and 5.
Perfect. Number 3, what is the most adventurous thing you've ever done?
Wow. Well, I would say, wow, what an adventurous thing I ever done was, I think, I want to say, recovery, but because I thought it was all about sobriety, and it wasn't. But I guess adventurous thing I ever done was, a lot of times I didn't think it was adventurous. Being a father is an adventure, that's for sure. I didn't enter into it. I just thought, like, that's part of the play. That's this next chapter of my life, I had to do this. But when you look back, it was like, damn, anyone that does that, that's pretty adventurous. And yeah, so it took me a while to kind of appreciate that, but I certainly do now.
At number 5, what's one quality in others that you admire and try to embody?
I think vulnerability, I think I get a lot of credit for, like, oh, you're so wrong, you put yourself out there, but because it feels good, but I feel like there's a lot I can continue to lean into that. So I take inspiration from the people that are so comfortable in that, and I want to be around people like that. So I think it's people that are vulnerable in this world that want you to be a certain way and act a certain way, and people that are their authentic self, which is what vulnerability delivers. Man, I'm trying hard to get to that place. I'm learning more and more, but it really, the frightening thing for me was, when I got into recovery, was like, this authentic person. What's if people don't like that person? What's if I don't like that person? That was scary. I'm not afraid of that anymore. I know I'm liking that person more and more, and I'm finding that so is everyone else.
That is such a beautiful answer. I love that so much. And that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guest, Tom Farley, for joining us today. So thank you.
Thank you. I am so excited to be there with you in a couple weeks, and it's just kind of meeting all the people that do such great work. Looking forward to it.